It is possible to prevent by putting in place those measures that we have talked about. Personal hygiene is very important. And this is something that is everywhere in the country. Water with soap is available in the whole country. In every part of this county where we are, in every part of the other counties that we are serving here, and the whole of Kenya, there is always water and soap. And that is what we are asking, is that after you meet somebody or after you touch any surface, is that you make sure that you wash your hands with running water and soap. And if you have a hand sanitizer, you can use it. The other thing is to avoid overcrowding. You know, particularly if there was any suspected case. And you see right now in this region we don't have any. So we do not want to cause any panic. We just want to say that should there be any case, and this will be declared by the Ministry of Health if there is any, then those interventions will be put in place. But there is no cause for alarm, and nobody should be worried for now, other than to put in place just the personal hygiene and minimize on any overcrowding. And secondly, you asked about the airports, and I think under the task force at the ministry, at the national level, appointed by His Excellency the President, they have actually put in place all the measures as outlined by the World Health Organization and even CDC, the Centers for Disease Control. And if you look at the checklist, the national task force has put in place everything in all the airports. All passengers arriving from regions which have declared or which have had positive cases are being screened appropriately. And you have also had even some flights from certain areas have been suspended for the time being. So those are the measures, ladies and gentlemen, that are required to be put in place. Health workers, you have heard the doctors speak and the members of the task force that they have trained what we call the front line, the ones at the entry points. They have trained all of them. And they have several, they go into hundreds. The emergency department, ambulatory, sick child, private wings, all the way across the whole hospital. And in every department of the hospital, that's why we have a multidisciplinary team. We have champions who had also been trained. And in fact, the Ministry of Health is leading with national training, and there is a training that is going on in Nairobi as we speak. And the team in the ministry also is coming down here to add on our efforts to train even more